The greatest need in the management of narcolepsy currently, in my opinion, has to be divided into two items. The first is an ability to provide for additional pharmacologic treatment that is still not perfect yet. I'll give you an example. We often see patients who are on 2 or 3 different narcolepsy medications. Despite that, despite appropriate dosing and despite the maximum ability to really combine certain medications with certain mechanisms of action, we still see patients, perhaps about a third of patients who are still requiring treatment because the daytime sleepiness is not entirely under control. So I think there is a huge issue in that the pharmacologic treatment is still not sufficiently addressing the patient's symptoms as they present. Even though in the last few years we've seen new medications with new mechanisms of action, we still need a lot more, specifically focusing on interventions that target the underlying process of hypocretin deficiency, particularly in narcolepsy type 1. The second issue of important need is to maintain some consistent ability to test those individuals. The test for narcolepsy is extremely tricky. You have to have the patient complete a sleep diary or undergo an actigraphy, which is a sophisticated sort of a Fitbit device that measures sleep and wakefulness. But we want to be able to get the test for narcolepsy, validating how much sleep the patient has gotten, consistently performing the sleep study before the multiple sleep latency test, and then being able to provide for a more effective way than just bringing the patient for 2 very expensive sleep testing. So now in certain practices and certain healthcare systems, there is an ability to test for hypocretin deficiency by doing a cerebrospinal fluid evaluation for hypocretin deficiency. That's available here in the US for the first time since April of last year, but it's not widespread and it's not available for all clinicians, and it's expensive, and it only allows you to diagnose narcolepsy type 1. So I think the more ability to really zoom down and provide for more quantitative assessment to corroborate and validate the diagnosis would be a huge help. And I think we'll get there in the next few years.